prenatal development, birth, and the newborn baby. Fetal development takes 38 weeks or 40 weeks past the last menstrual period. There are 266 days in the 9-month gestation period for humans. 266 days of prenatal development. It is a Chinese custom to celebrate the day of conception rather than the day of birth. About every 28 days, an ovum is released by one of the woman's ovaries and makes its way to one of the fallopian tubes on either side, leading to the uterus. This is where fertilization usually takes place, in the fallopian tube. The ovum only lives one day after being released. The spot on the ovary from where the ovum was released is called the corpus luteum, which sends hormones to the uterus to prepare for possible implantation. The extra cushy lining of the uterus that is placed there to receive a fertilized ovum will slough off in a menstrual cycle 2 weeks later if pregnancy does not occur. While the woman releases one ovum every 28 days, a man produces 300 million sperm a day in the testes, which are 2 glands in the scrotum sac. Sperm grow a tail that facilitates swimming to find the ovum. They can live up to 6 days after being released. 120 to 150 males are conceived for every 100 females. Sperm with smaller Y chromosomes are much more mobile and faster. 105 males are actually born for every 100 females. Males are more vulnerable to damage and spontaneous abortion. That accounts for why 120 to 150 are conceived for every 100 females, but only 105 are actually born for every 100 females. The human brain begins developing at 2 weeks after conception and continues into early adulthood. At birth, the brain weighs less than a pound, but has the most neurons it will ever need. An adult brain weighs about 3 pounds and contains fewer neurons because along the way the unused ones, the unneeded ones, are discarded or pruned. The early prenatal development of brain cells and their migration to the appropriate brain areas are critical steps. Lots can go wrong. Development follows 2 principles. There is a cephalocaudal, head-to-tail pattern of development where the head develops faster than the trunk. The central nervous system, the CNS, however, develops from tail to head. Spinal cord and brainstem develop first. Cerebral cortex develops last. There is also a proximo-distal, near to far pattern of development, where the heart and digestive system develop before the limb buds, and the limb buds develop before the fingers and the toes. There are 3 stages of prenatal development: the germinal stage, the embryonic stage, and the fetal stage. The germinal period lasts from fertilization through week 2. The zygote takes 30 hours after conception to complete its first cell duplication. Then the duplications go faster, and by the 4th day there are 60 to 70 cells forming a hollow ball-like structure called a blastocyst. The inner part of the blastocyst becomes the embryo. The embryonic disc is what this is called. The outer part is called the trophoplast, and this forms the embryo's life support system of nourishment and protective covering. The trip from the fallopian tube to the uterus takes 3 to 4 days. Between the 7th and 9th day past fertilization, the blastocyst implants in the lining of the uterus. Rapid cell division by mitosis and cell differentiation occurs with the outer part, the trophoblast. It is multiplying faster to form the membrane called the amnion, which will hold the amniotic fluid that cushions and regulates temperature. Also formed is a yolk sac for the production of blood cells until the liver, spleen, and bone marrow can take over. By the end of the 2nd week, the chorion forms and surrounds the amnion. It is a protective membrane formed by the trophoblast. Blood vessels called villi dig into the uterine wall and form the placenta. This organ connects from the uterus to the developing human via the umbilical cord. The umbilical cord has a large vein to bring food and oxygen in, and 2 arteries to carry away waste. 58% of conceptions do not survive the germinal period. 11% of conceptions succumb later. The embryonic period lasts from weeks 2 through 8. After the zygote is implanted, it is called an embryo. All the major organs and body parts form. The developing embryo is quite vulnerable to teratogens or environmental insults. The placenta develops and begins to function. First week of the embryonic period has the embryonic disc forming 3 cell layers. The ectoderm is to become the nervous system and skin. It develops fastest. It folds over to form a neural tube which will become the brain and the spinal cord. The mesoderm is to become the muscles, skeleton, circulatory system. The endoderm is to become the digestive system, lungs, urinary tract, and glands. As already mentioned, the human brain begins developing at 2 weeks after conception and continues into early adulthood. The early prenatal development of brain cells and their migration to the appropriate brain areas are critical steps. Lots can go wrong. At 3.5 weeks, neurons begin forming at 250,000 per minute. They travel along threads to their respective permanent brain places. At 1 month, the tiny heart beats 65 times a minute. At the end of 1 month of development, the embryo is 1/4 of an inch long and is made of millions of groups of cells organized to do specific functions. By 5 weeks, the brain, resembling a lumpy inchworm, is developing the convoluted cerebral cortex, that part of the brain that will develop the powers of moving, thinking, speaking, planning, and creating. By the end of the 2nd month, the embryo is 1 inch long and weighs 1/7 of an ounce. It can respond to touch, especially around the mouth and the bottom of the feet. It can move, but the mother cannot feel the movements. If stroked, an 8-week fetus will respond by flexing its trunk, extending its head, and moving back its arms. There are skin, eyes, ears, nose, jaw, tongue, neck, arms, fingers, thumb, legs, knees, ankles, and toes. Handprints and footprints can be made. The heart has separate chambers, and the liver and spleen have put the yolk sac out of a job. All major body parts and organs have been established. Congenital or birth defects can result from defects in the baby's genes or from the effects of teratogens. Teratogens, or environmental agents which harm the prenatal development of humans, do their most damage during the embryonic period of weeks 3 through 8. The nervous system is vulnerable, however, long past this, and so are the eyes and genitals. With the appearance of the first bone cells, the embryo enters the fetal stage of development. The fetal period lasts from week 9 to birth. There is more growth and structural refinements of major body parts that were already formed during the embryonic period. The embryo is now called a fetus, and it is increasingly responsive to outside stimulation, and it is more able to behave in regular, integrated ways. The developing fetus takes on a visibly human form. By 9 weeks, this fetus can hiccup and react to loud noises. Sex organs are developing. Ultrasound can determine the sex. At 3 months, the heartbeat can be heard with a stethoscope. There are fingernails, toenails, closed eyelids, vocal cords, lips, and nose. Sex can be seen by the 12th week as the genitalia are well formed. Fetus can swallow, breathe amniotic fluid, suck, urinate, squint, yawn, make a partial fist, and move thumbs, legs, and head. It can feel and it can smell. By 13 to 15 weeks, it can taste with adult-like taste buds. While talking about the capability of taste, it would be well to mention here that during the last trimester, the fetus swallows up to a liter of amniotic fluid a day. The fluid can smell and taste of garlic, onion, curry, and other spices. This may be a flavor bridge to breast milk, which also smells and tastes of flavors and spices in the mom's diet. By 4 months, between 17 and 20 weeks, the mother may experience quickening or the fetus kicking, unless it is her first pregnancy. With subsequent pregnancy, not only may moms be more aware sooner of subtle quickening sensations, but also the uterus is bigger and the umbilical cord longer. More freedom of movement is allowed, so fetuses can experience more movement and may become more active infants later due to all the practice. Movement actually begins in the 7th week, but is undetected by the mother. By 5 months, the fetus is more active with its movements. The fetus moves 50 times an hour, whether awake or asleep. Lots of touching and self-stimulation is done. There's hand to hand, hand to foot, foot to face, arm, umbilical cord, foot to leg, etc. The fetus has sleep-wake cycles. It can hiccup. It is growing coarse hair for eyebrows and eyelashes, and fine hair on its head. The body is covered with lanugo, downy hair. Lanugo helps the vernix, a white cheesy-like substance, adhere. Vernix protects the skin from chapping in the amniotic fluid. Male fetuses are more active, which suggests that boys' tendency to be more active later may be at least partly inborn. Those with irregular sleep-wake cycles sleep worse as infants. A 20-week-old fetus will try and shield its eyes with its hands during a fetoscopy, which has a lighted scope. Vision is the last sense to develop. The fetus may see light and shape. The womb is not totally dark. Some light is filtered through the mom's tissues. The fetus reacts to light flashes. Bright light can be dangerous. When a fetus is forced to see too much too soon, like for preemies, problems in development may result. The retinal damage blamed on high oxygen concentration may really be due to overexposure to light at the wrong time. A condition that retinal damage results with is called retrolental fibroplasia. That's the technical term for retinal damage. Retrolental fibroplasia. By 6 months, the fetus has complete eyes that can open, close, and look around. It can hear, cry, and make a strong fist. In utero, the fetus not only recognizes mom's voice, but is calmed by it. The fetal heart rate slows when mom talks. Sudden noises can make the fetus jerk or kick. The womb is not silent. It is equivalent to background noise in an apartment, with blood whooshing and stomach and intestine making noises, and outside voices coming through. At the end of 6 months, most of the billions of neurons are present. Few neurons will develop past this point, but glial cells continue developing so that the brain weight by birth is 10 times what it was at 20 weeks. Pain sensitivity happens between 23 and 30 weeks, so that any painful procedures should be accompanied with painkillers. By 7 months, the fetus weighs between 3 and 5 pounds. Lanugo may disappear. The fetus at 32 weeks is behaving like a newborn, deep sleeping and REM sleeping, or dreaming about what they know, womb sensations. The fetus drowses 90 to 95% of the day, including an indeterminate state peculiar to the fetus's immature brain. A newborn sleeps 85 to 90% of the time. By 8 months, the fetus has cramped quarters and does not move as much. A layer of fat forms to protect the fetus from temperature changes later. The mother's blood also provides antibodies to the fetus to protect it against illnesses. The fetus's immune system is not up to the task of protection for several months. By 9 months, the fetus is ready for birth at an average 7.5 pounds and 20 inches in length. Boys are heavier and longer than girls at birth on the average. Female fetuses develop skeletally ahead of males. At birth, the bone development of girls is 4 to 6 weeks ahead of boys' bone development. Drugs, illegal, legal, and over-the-counter, can be detrimental. Illegal drugs such as heroin and methadone pass through the placenta and produce addiction in infants, including the withdrawal effects of vomiting, tremors, and convulsions. In addition, heroin and methadone overload the nervous system, producing hypersensitivity, which leads to avoiding normal environmental stimuli and missed opportunities to learn. Learning and behavior problems are commonplace. Cocaine produces even more severe effects than heroin and methadone. Cocaine and crack, which is the less expensive and smokable form, are the most common illicit drugs used by women of childbearing age. Miscarriages, stillbirths, and premature deliveries are much more frequent for cocaine crack users. It is hard to pinpoint the effects of cocaine, since many users are also multiple drug users with poor prenatal care, nutrition, and health. Marijuana gives a double whammy. There's the drug effect, plus there's oxygen deprivation. THC, the main ingredient, crosses the placenta easily, but it is cleared very slowly by the fetus. Fetal exposure to THC has been linked with altered visual and startle responses in newborns. It has been linked with behavior deficits in school-age children, and it has been linked with verbal and memory deficits in 4-year-olds. As for legal drugs, they and prescribed medical drugs should be avoided unless absolutely necessary, even aspirin. Tylenol is recommended over aspirin and ibuprofen due to third trimester complications. Accutane, used in treating severe acne, should be avoided during pregnancy. It is very dangerous, especially in the first trimester. Thalidomide, a sedative prescribed in the 1960s for morning sickness, caused a variety of birth defects, deformed limbs, depending on when it was taken. DES, a synthetic estrogen, was prescribed in the late 40s and early 50s, with the mistaken notion that it would prevent miscarriages. Daughters, 1 in 1,000, born to mothers who took DES, developed a rare type of vaginal or cervical cancer after puberty. Sons had abnormal testes development. The most common legal drugs are nicotine, alcohol, and caffeine. Smoking increases the risk of prematurity and low birth weight. 25% of pregnant women smoke. Smoking decreases the amount of oxygen that reaches the baby by increasing the levels of carbon monoxide in the blood and by constricting tiny blood vessels, including those in the placenta. Low oxygen levels raise the fetal heart rate. Increased fetal heart rate has been measured in pregnant women after smoking 2 cigarettes in 10 minutes. Smoking is the single most known factor associated with low birth weight and is found in 1/5 of all cases of low birth weight. Smoking increases the fetus's susceptibility to other teratogens. Babies born to mothers who smoke during and after pregnancy are 3 times more likely to die from SIDS, sudden infant death syndrome. Heavy smoking also is responsible for compromised brain development and cognitive deficits. Nicotine is linked to poor attention, learning problems, and behavior problems. Nicotine has a devastating impact on brain development. Newborns are less attentive to sounds and are more prone to colic and have more muscle tension. Passive smoking is also connected to low birth weight and attention problems and learning problems. 1/3 to 1/2 of non-smoking mothers are passive smokers who live or work near others who smoke. The next common legal drug, alcohol. This increases the risk of stillbirths and irreversible defects like fetal alcohol syndrome. Even moderate drinking by the mother during pregnancy can increase the risk of behavioral disorders in the child. Alcohol interferes with the production and migration of neurons to their proper places in the embryo's brain. Plus, the mother takes more available oxygen to metabolize alcohol, thus depriving the embryo of the oxygen it needs for cell growth. 50% of babies born to heavy drinking mothers suffer some form of birth defect. Infants of binge drinking mothers and those who drink heaviest during early pregnancy have the highest risk. The more alcohol, the greater the problems with motor skills and achievement test scoring in childhood, and the more problems with antisocial behavior and mental problems in adolescence. There is no known safe amount of drinking, so alcohol should be avoided even before conception and continue to be avoided until after breastfeeding has stopped. A drunk mom means a drunk fetus. Alcohol kills fetal neurons. A hangover lasts a lifetime for a fetus. Women get drunk from less alcohol than men do due to faster absorption and slower metabolism. Caffeine is the third most common legal drug, and it should be avoided by pregnant women. Earlier studies have shown that consuming caffeine in amounts of 2.5 cups of coffee a day can double infertility rates. The Journal of the American Medical Association in December of 2000 published the results of a correlational study done on 1,500 pregnant women in their first trimester in Sweden. Those who consumed 1 to 2 cups of coffee had a 30% increase in miscarriage of normal pregnancies. Those who drank 4 cups had a 40% increase in miscarriage of normal pregnancies. Those who drank more than 5 cups a day had a 220% increase. We cannot assume cause and effect. There may be a hidden variable unaccounted for. However, the figures are strong enough that it makes good sense to urge pregnant women to refrain from caffeine. Pregnant women metabolize caffeine more slowly. Caffeine readily passes through the placenta, and the fetus cannot detoxify caffeine. Newborns exposed to high caffeine levels prenatally can suffer withdrawal and display irritability and vomiting. There are other environmental hazards that threaten prenatal development. Radiation can cause mutations of genes as evidenced by the tragedies of Hiroshima, Nagasaki, and Chernobyl. There was a greater incidence of mental retardation, small head size, chromosomal abnormalities, seizures, and school performance. The time of greatest vulnerability was 8 to 15 weeks after conception. Even low-level radiation from industrial leaks or medical X-rays can increase the risk of cancer in the child. Mercury is to be avoided by pregnant women. Predatory fish like shark, swordfish, and albacore tuna are heavily contaminated with mercury. Prenatal exposure to mercury can result in considerable brain damage by interfering with the production and migration of neurons during brain development. PCBs, polychlorinated biphenyls, are used to insulate electrical equipment, and they have been banned. children born to mothers who ate fish from lake waters contaminated with PCBs were found to have lower IQs and delayed reading comprehension. At high level PCB exposure prenatally, the baby can suffer from low birth weight, abnormalities in brain waves, skin deformities, and slowed cognitive development. At low level PCB exposure, decreased birth weight, smaller head size, trouble with attention and memory and testing abilities can be expected. Dioxins are toxic and result from incineration. Exposure leads to brain, thyroid, and immune system damage. Dioxins are also implicated in increased incidence of breast and uterine cancers in women due to the interference with hormone levels. Diseases can interfere with prenatal development as well. Many viruses can pass through the placenta and affect the developing child. Rubella, or German measles, early in pregnancy may result in blindness, deafness, mental retardation, and heart defects. A vaccine became available against rubella in 1969. 30% of HIV-positive mothers pass the HIV virus onto their babies. Babies infected get symptoms by 6 months of age. They die within 5 to 8 months more. ZDV, zidovudine, during pregnancy and at delivery has helped reduce the incidence of transmission by 95%. Herpes viruses such as cytomegalovirus and herpes simplex 2 endanger the embryo or the fetus. When a woman who has never had CMV infection becomes infected with it for the first time in pregnancy, there is a potential risk that after birth the infant may have CMV-related complications, hearing loss, visual deficits, or decreased mental and motor abilities. Infants and children who acquire CMV after birth have few, if any, symptoms or complications. 50 to 85% of Americans have had CMV by age 40 years. Women with no antibodies for CMV should be extremely diligent with hand washing during pregnancy. Herpes simplex 2 is a sexually transmitted virus which can potentially infect the fetus fatally. Mothers with active herpes simplex 2 need to deliver by cesarean section. Both CMV and herpes simplex 2 proceed from the genital tract of the mother to infect the developing embryo or fetus, causing miscarriage, low birth weight, and or brain damage. Toxoplasmosis is a parasite, or rather it's the condition caused by a parasite that lives in the bodies of sheep, cows, and pigs, and in the intestinal tract of cats. This parasite may cause brain damage, blindness, or death in the first trimester, with no symptoms or cold-like symptoms in the mother. Later exposure may result in milder visual and cognitive deficits. Pregnant women should not fool with cats, cat litter, or dig in gardens in which a cat may have buried feces, nor should she eat raw or rare meat. The nutrition of pregnant women should not be neglected. The mother-to-be should eat 300 to 500 more calories daily and plenty of protein. she should gain 20% of her ideal pre-pregnancy weight, which for a 130-pound woman would be 26 pounds. Gaining too little increases the risk of miscarriage and is worse than gaining too much. The weight gain needs are minimal at first, and this is fine considering how nausea may interfere with the desire to eat anyway in the beginning. Midway in pregnancy until 2 years after birth, the baby's brain growth is very sensitive to quantity and quality of nutrition. Malnutrition during the last months of pregnancy results in low birth weight babies and a possible negative effect on neurological development. An adequate supply of vitamins and minerals, especially calcium, is important for normal prenatal development. Vitamins are good, but way too many of certain ones are not good. These certain ones that you don't need an excess of are A, B6, C, D, and K. Folic acid is a B vitamin, and it is very important. A pregnant woman needs 400 micrograms a day, but not more than 1 milligram a day. Folic acid is necessary to reduce cases of spina bifida and other neural tube defects like anencephaly. You can reduce these incidences by 60% with adequate folic acid. The diet should include liver, beans, peanuts, peas, green leafy veggies, broccoli, citrus fruit, orange juice, and whole grains, all of which contain folic acid. A pregnant woman should refrain from hot tubs or saunas where the temperature is raised more than 2.7 degrees. Neural tube closure begins 8 days after a missed period. Women should take folic acid for at least 1 month before conception and throughout the first trimester. Spina bifida is one of the most common birth defects in children and occurs in 1 of 1,000 pregnancies. The vertebrae surrounding the spinal cord fail to form completely in the developing embryo. Exercise by the mother-to-be should be moderate. She shouldn't raise her heart rate above 150. These exercise sessions that are moderate should also not end abruptly. The mother should taper off and not end them suddenly. Extreme continuing maternal stress during pregnancy may contribute to pregnancy problems and to later development of the child. Hormones released in response to high stress impact the fetus, making the infant more active and more irritable. Mild occasional stress is of little concern. Intense anxiety is linked to pyloric stenosis and cleft palate. Pyloric stenosis is an uncommon digestive condition that affects the opening at the lower end of the stomach that connects the stomach and small intestine, called the pylorus. In pyloric stenosis, the muscles of the pylorus become abnormally large, preventing food from entering the small intestine. This results in forceful vomiting, dehydration, weight loss, and electrolyte imbalances. Prompt surgery is necessary. Babies are generally between 3 and 12 weeks old when diagnosed. 2 to 4 of every 1,000 babies are affected. Cleft lip and palate happen during the 6th to 10th week of pregnancy. Bones and tissue of a fetus's upper jaw, nose, and mouth normally fuse to form the roof of the mouth and the upper lip. But if they don't fuse properly, cleft lip, cleft palate, or both may occur. The emotional response to stress is more aversive to the pregnancy than the stressor event itself. Normal stress causes the hypothalamus to release CRH, corticotrophin-releasing hormone. CRH is a major regulator of the stress response. CRH triggers the release of ACTH, and this ACTH triggers the release of cortisol from the adrenal glands. Cortisol stops the release of more CRH and thus stops the stress response. During pregnancy, levels of CRH and other stress hormones increase gradually instead of being shut down, and these in part determine the time of labor and delivery. Women who deliver too soon have a much higher level of CRH sooner in their pregnancies than women who deliver full term. Highly anxious women endure more stress and respond with more CRH as early as 18 weeks into the pregnancy. Normal stress is fine and beneficial. Intense anxiety is not. Blood flow to the uterus and the fetus is decreased, so that blood flow to the brain, heart, arm, and leg muscles can increase for fight or flight. This means that a mother experiencing intense anxiety again and again has less oxygen and nutrients going to the baby. There is a positive correlation between stress and unhealthy behaviors which contribute to premature delivery, like smoking, drug use, and inadequate prenatal care. There is also a connection between maternal stress and later anxiety, aggression, and overactivity in the school-aged child. Social support from significant others and family and friends will appreciably reduce maternal stress response. But there is another variable called optimism, or positive expectations, which may influence the outcome of a pregnancy more than stress does. Optimism lends a measure of control and sidesteps the stress response. More effective coping skills are used rather than the ineffective ones, like avoidance, avoiding people, avoiding thoughts of the birth, sleeping too much to escape. Less optimistic women delivered earlier and had lower birth weight babies than optimistic women. And this was done in studies whereby factors of diet, smoking, miscarriage history, and diabetes were controlled for. More prenatal factors. Blood type incompatibility is one. An Rh-negative mother does not have a protein substance called Rh factor in her blood. If she delivers an Rh-positive child, her body will produce antibodies that will attack red blood cells of subsequent Rh-positive babies unless she is injected with RhoGAM within 3 days after delivery. With destruction of red blood cells, bilirubin increases suddenly, too high for a baby's liver to break down. This can result in brain damage, cerebral palsy, and deafness. Maternal age is another factor. Miscarriage rates are highest for teenagers and for women over 35. After age 30, women have more trouble conceiving. But if they conceive and carry the baby to term, chances are very good that the baby will be healthy. The only birth defects that increase with maternal age are those caused by chromosomal damage, like Down syndrome. There are paternal factors to know about when talking about prenatal development. Fathers can donate a sperm that has become altered in response to lead, alcohol, cocaine, radiation, or pesticides. Also, sperm can pick up toxic passengers like cocaine, lead, and mercury that hitchhike or attach to the sperm and enter the ovum during fertilization. Even if the sperm is healthy, it can pick up cocaine from a mother who has it in her system. Fathers deficient in vitamin C are more prone to having children with birth defects. Paternal smoking increases the risk of small birth weight. One study estimated that the baby weighed 4 ounces less for every pack a day the father smoked. Passive smoking also decreases intellectual development. 6 to 9-year-olds perform midway between children whose moms smoked and children from smoke-free homes. A study done in China where men smoke but women generally do not found a positive correlation between the father smoking and childhood cancer. The more a father smoked, the more likely the child was to develop leukemia and lymphoma. New evidence implicates paternal alcohol use at the time of conception to be problematic. Gene expression can be altered to promote low birth weight, heart defects, and overactivity. Prenatal care is essential, especially for mothers with health problems like diabetes and high blood pressure and epilepsy. Toxemia or preeclampsia can cause convulsions in the mother and death for the fetus. Blood pressure soars suddenly and swelling occurs in the mother's face, hands, and feet. 5 to 10% of pregnant women experience toxemia in the last half of their pregnancies and must receive immediate care to lower their blood pressure. Delivery must occur at once if the blood pressure does not decrease. 16% of pregnant U.S. women receive no early prenatal care. One reason is lack of health insurance. The very poor qualify for government health services. Lots of low-income mothers, though, do not qualify. They are not destitute enough. Others have no transportation and have the added burden of additional children to care for. Labor is real work for both mother and child. The name fits. When the time is right, usually about 266 days after fertilization, the baby's brain triggers endocrine changes within his or her body, which signals the mother's body to produce a lot of estrogen. Estrogen stimulates the uterus to contract and the cervix to widen. There are 3 stages of labor. The first stage is the longest and lasts about 12 hours or more, with shorter first stages for subsequent deliveries. The cervix, or the opening at the bottom of the uterus, is dilated. It opens like the lens of a camera to 10 centimeters, or about 4 inches. The cervix also becomes effaced or flattened out and softened. Transition is the period from 8 to 10 centimeters dilation, when the baby's head begins to move into the 4 to 5 inch long vagina. This all takes place in the first stage. In the second stage of labor, the baby moves into the vagina and is born head first, facing the mother's spine. This stage lasts about 1.5 hours or less. In the third stage, the afterbirth is delivered. That is, the placenta and the remainder of the umbilical cord. This stage lasts 5 to 30 minutes. At birth, the infant is covered with a whitish coating, vernix caseosa, which protects against infection. This dries up entirely within a few days. The newborn produces large amounts of adrenaline, noradrenaline, and cortisol with the hard effort that comes with being born. These hormones at birth do a lot of good work. They help the lungs to become clear of fluids so they can begin breathing air. They activate stored fuel. They route blood to the brain and to the heart. They contribute to alertness. They promote the mother-child bond. The APGAR scale is used to assess the baby's immediate condition. A score of 0, 1, or 2 is given to each of 5 measures at 1 minute after delivery and at 5 minutes after delivery. The 5 measures are represented by the letters in APGAR. A for appearance or color, P for pulse or heart rate, G for grimace or reflex irritability, A for activity or muscle tone, R for respiration or breathing. The maximum score is 10. The Brazelton scale is another neurological assessment used to measure a newborn's response to the environment. It takes about 30 minutes to give on day 3 or 4, and again on day 9 or 10. 20 basic reflexes are tested, as well as baby's interactive behavior on 27 items during different states of alertness, sleeping, and crying. For the first few days, the newborn loses weight up to 10% due to water loss, but regains the birth weight by 10 to 14 days old. Half of babies have a degree of jaundice, which makes their eyeballs and skin look yellow. This is due to a buildup of bilirubin, a yellow pigment occurring naturally as red blood cells are broken down in the liver. This jaundice can last from 2 to 3 days to 1 to 2 weeks. This is due to liver immaturity and can be treated quite successfully with medicine, more feedings, and putting the baby under fluorescent lights. Molecules of bilirubin absorb the radiation from the ultraviolet fluorescent light. This triggers a photochemical reaction breaking down the bilirubin. Blue is the wavelength of light which emits the safest and strongest amount of ultraviolet light. Low birth weight babies are babies that weigh less than 2,500 grams or 5.5 pounds at birth. Low birth weight babies have a mortality rate that is twice as high as the rate for heavier babies. Males with very low birth weight have more problems in later childhood than females do. There are 2 categories of low birth weight: premature and small for gestational age. Premature babies are born before completing 37 weeks of gestation. Small for gestational age applies to babies weighing less than 90% of all babies of the same gestational age. This can be the result of smoking by the parents or inadequate prenatal nutrition. Small for gestational age is even more detrimental than prematurity. There are greater risks for lasting impairments. Those weighing less than 5.5 pounds are considered low birth weight from slowed prenatal growth and or prematurity. Low birth weight is strongly associated with poverty and lack of maternal education. Consequences of low birth weight include an underdeveloped immune system and a greater vulnerability to disease. There is inadequate sucking reflex, which necessitates IV feedings. There's insufficient fat to keep the baby warm. There may be hyaline membrane disease, whereby the lungs lack a coating of surfactant, so the air sacs collapse. There is an increased risk of cerebral palsy. According to some research done by Schindel in 1996, magnesium sulfate given to mothers suspected of carrying a very low birth weight baby may decrease the risk for cerebral palsy by 90%. Low birth weight babies do far better if they receive continuing medical follow-up and plenty of touching and massaging and responsive social support. The newborn has to take over for all the favors that the umbilical cord provided before birth, like circulation. The umbilical cord cleaned up the blood by taking away used blood and returning a clean supply by way of the placenta. Now the baby's on its own, and it takes about 10 days for the heartbeat and blood pressure to become more uniform or stable. The umbilical cord also provided respiration. The cord brought oxygen to the fetus and carbon dioxide away. Now the baby has to go it alone and needs more oxygen. The baby is vulnerable to respiratory infections. If deprived of oxygen, a condition known as anoxia, then brain damage occurs. With the first breath, big changes occur. Temperature and pressure changes force the baby to breathe and create a vacuum in the chest cavity. This vacuum forces blood to flow toward the pulmonary artery and lungs. Since the blood flow changes, the opening between the two auricles of the heart is not needed anymore, and a tissue flap closes it. The baby is bluish for moments as circulation through the pulmonary system becomes established. Then the color turns more pink, and the umbilical cord is clamped and cut. Gastrointestinal jobs were also done by the umbilical cord. The cord brought food to the fetus and brought wastes away. Now the baby's on its own. The stool of a new baby is composed of what we call meconium, which is stringy and greenish black. The baby also has to provide temperature constancy for self. Temperature was pretty stable in utero, but after birth there are more fluctuations to get used to. Layers of fat help. So does increased activity when the air temperature drops. Brain development is far from complete at birth. Infants have almost the entire number of neurons that they will ever have, but brain development is not complete. Depending on stimulation and experience, the neurons will increase in cell size and interconnections. High-quality nutrition is essential for optimal brain development. At birth, the brain weighs less than a pound, but has the most neurons it will ever have. An adult brain weighs about 3 pounds, but contains fewer neurons, since unused or unneeded ones are discarded or pruned along the way. Connections are made, and pathways are extended between neurons, setting up an elaborate communication system that refines and stabilizes with sensory experience. Stimulation from the environment, sensory experience, along with good nutrition, are necessary for the brain to develop optimally. If a connection is not used or needed or damaged, then it may be lost. This shows an interaction between biology and environment. The central nervous system has its own genetic blueprint, but its development can be enhanced or impeded by environmental events. A large proportion of neurons in the brain of a newborn require sensory input from the environment in order to hook up and connect properly. Babies come equipped at birth with several pre-wired capabilities that aid survival. They have reflexes which are automatic reactions to certain stimuli. Rooting and sucking reflexes for nourishment, gagging reflex to protect against choking, crying reflex to elicit caregiver's attention. When a nursing infant looks up from the breast, the muscles in the middle ear tighten reflexively, setting the stage for reception of human voice pitch. Other reflexes are automatic as well, but without obvious survival built into them, like the grasping reflex that helped baby monkeys hold on to mother's hair, and the stepping reflex, and the moral or startle reflex, gone by 2 to 3 months. The primitive reflexes give way and disappear as voluntary behaviors develop. And as the myelin sheath on axons develop more, babies can move smoothly and more deliberately and less jerky. Some reflexes have ongoing usefulness and are kept throughout life, like blinking, yawning, coughing, sneezing, gagging, shivering, and the contracting and dilating of the pupils to light and to dark. Babies generally sleep from as little as 11 hours to as much as 21 hours per day, with an average of about 16 to 18 hours daily. 50% of a newborn's sleep is in REM sleep, REM sleep, rapid eye movement sleep. By age 3 to 5 years, the child spends 20% of sleep time in REM sleep, much like an adult. Newborns fret 10% of their awake time and cry hard for 2% of the time. Different cries mean different things. Hungry cries begin as a whimper and gradually build up to louder, full-fledged cries. Upset cries begin loudly and suddenly. Pain cries begin with a higher pitch. Some babies are more easily comforted by others and by self. Others are inconsolable. Parents of colicky babies who are inconsolable lose confidence in themselves because they feel nothing they can do will help. Parents can't take it personally. Parents must know that the baby needs them ever so much. And parents should be encouraged to interact anyway, even if they feel they're not doing any good. They must continue responding lovingly, even if they feel that the baby is not responding back. Crying babies can be soothed with cuddling, stroking, and swaddling, or wrapping them snugly in a receiving blanket. They can be soothed with rhythmic sounds of a swing or singing. There are times, though, when a baby simply needs to cry. If you've done everything like feed, diaper, check for ill-fitting clothes, burped, and the baby is not ill with an ear infection or a virus, don't feel negligent by letting the baby cry. Some babies are not given enough opportunity to cry. Some doctors believe that SIDS, sudden infant death syndrome, is associated with a low-pitched cry. Babies exposed to marijuana prenatally have a unique cry. Malnourished babies have a unique crying pattern. High-pitched, low-intensity, long duration, arrhythmic, and extended pauses. Kittens and human babies have similar isolation cries when they're separated from their mothers. The sounds originate in the hypothalamus, which disputes Chomsky's view of language as uniquely human. Speech may be more similar to animal communication than previously thought, only far more complex. SIDS, SIDS, sudden infant death syndrome, is also known as crib death and sleep apnea in infants. It is the third leading cause of death in infants in the United States and occurs most often between the ages of 2 and 4 months. SIDS affects 1 in 500 babies. Smoking around the baby increases the risk of SIDS, as does sleeping on the stomach, face down. Placing an infant on its side or back has dramatically reduced the incidence of SIDS by 50%. To overcome minor motor delays in rolling and crawling, give baby tummy time during waking hours. Autism is a pervasive neurological disability that can have varying degrees of severity and is evident within the first 30 months. Autism occurs in about 4.5 children per 10,000 live births. How can you have a 0.5 child? How about saying it occurs in about 9 children per 20,000 live births? That makes more sense. It occurs in 3 times as many boys as girls. It is very difficult for parents and educators because of the deficits in language and social relations. Children with autism give no or very limited emotional response. 80% with autism also have mental retardation. Autism victims seem isolated, aloof, detached, and have strange habits like rocking and hand flapping, head banging, avoidance of eye contact, insensitivity to pain, and self-injurious behavior. They are fascinated by mechanical devices and appliances. Inquire with your pediatrician to see if immunizations contain thimerosal. Thimerosal is a preservative containing mercury and may be a factor in autism, especially when multiple vaccines are given at the same time. There have been a lot of conflicting research, and the jury is still out. Intense behavior modification programs, if begun by age 3 years, can have very good results treating autism. Research shows that 40 hours a week of this type of program results in a 43% success rate. 10 hours a week yields only 2% success rate of victims with normal behavior. So the operative word is intense. There is also an option method by Susie and Barry Kaufman and a closing circles method by Dr. Stanley Greenspan. All of these methods treat autism, and there are more and more coming out all the time. B6 and magnesium benefits half of victims of autism. A few cases have reported spontaneous recovery, and some have even recovered enough to write accounts of their experiences. Never give up on a child. Sensation is the incoming flow of information. It is a baby's window on the world. As for the development of the senses in babies, a lot is dependent on nurture or experience. The structure of the sensory organs and receptors are determined by genes or biological blueprints, but the function is largely affected by early experiences. If a baby is denied sensory input for vision and hearing, then normal vision and hearing may be impaired permanently. There appears to be a critical period in the development of hearing and vision in which these senses are most sensitive to environmental input. If normal sensory stimuli are not experienced, or if distorted sensory stimuli are experienced, these will prevent the development of normal vision and hearing. Eyes, ears, and fingers are way stations which transmit signals to the brain. The brain takes sensory fragments and makes sense of them. It's not the nose that smells, or the eyes that see, or the ears that hear, or fingers that feel. It's the brain that does all of this. The sense of touch is well developed in newborns, especially around the mouth, palms of the hands, soles of the feet, and genitals. Gentle touch stimulates the release of oxytocin. Oxytocin cements mother-baby bond in many animal species, including humans. Premature infants massaged 15 minutes 3 times a day gained weight 47% faster than others. They did not eat more food, they just processed their food more effectively. These preemies were more alert when awake and had deeper sleep when asleep. At 8 months, these babies scored better on mental and motor tests. Touch heals. Massage can lessen severe burn pain and can boost the immune system of AIDS victims. Newborns can and do feel pain. Before circumcision, babies should be treated with pain-killing cream. Touch stimulates the release of pain-killing chemicals called endorphins. So it helps to hold and coddle and to offer sugar-sweetened solution by way of a nipple. Infants have a keen sense of smell early and prefer the smells that are associated with their mothers. Smell may play a major role in mother-infant attachment. The sense of taste is also well formed in infants, making it possible for babies to tell the difference among sweet, bitter, and salty. They prefer sweet, Surprise, surprise. Prenatal hearing is apparent as newborns can discriminate between sounds they heard in utero, evidenced by their increased sucking upon hearing recordings of sounds heard before, but no increased pattern of sucking to new sounds. So we know they heard prenatally. Babies hear higher frequencies than do adults, and are especially attuned in distinguishing human voice sounds. Fetuses can learn and remember, as evidenced by their ability to discriminate sounds. Babies in a control group had no stories read to them by their mothers, and they responded equally to all 3 stories read to them 3 days after birth. Babies who had a story read to them an average of 67 times during the last 6 weeks of pregnancy responded differently to that particular story than they did to the other 2 stories. They sucked more on a nipple that activated the recording of that story so that they could hear more of it. Newborns, 2 to 4 days old, prefer musical and speech patterns they heard in utero. They prefer their mother's voice to those of other women, female voices over male ones. They also prefer the filtered versions of their mother's voices, which assimilate the muffled sounds of voice through the womb. Newborns can distinguish mom's voice from another woman's even when asleep, as measured by distinctive brain waves. The inability of babies to hear human speech sounds properly may contribute to autism and the inability to relate emotionally to people. In autistic children, the neural system, including the middle ear, is lazy, which prevents them from processing human voice pitch. The tiny ear muscles should filter sound like eye muscles focus on near or far objects. Sounds are instead much lower, a rumbling or growling sound signaling danger. Anxiety prevents emotional interaction, so pathways controlling emotions do not develop. In order for an infant with normal hearing to hear a sound, the sound must be 10 to 20 decibels higher than what an adult can hear. What is barely able to be detected by an adult would not be heard by a newborn. About the faintest sound a newborn can hear is the rustling of leaves. Hearing improves, but takes 12 to 13 years to be up to par with an adult's ability to hear, just in time to be damaged with headsets and boom boxes. By the age of 6 months, a baby can detect changes in loudness and pitch very well. As for being able to tell from which direction a sound is coming, a baby is as accomplished as an adult by the age of 18 months. Hearing has been measured in infants using changes in eye blinks, changes in heart rate, and changes in electrical activity when noise is introduced. Ability to distinguish between sounds has been measured using habituation. Habituation is becoming so accustomed to a stimulus repeated over and over again that you lose interest or remove your attention from it. Babies are exposed to the same sound repeatedly until they habituate and ignore it. Then the sound is changed to see if the baby notices a difference by refocusing his or her attention. Babies with hearing difficulties should be given enhanced auditory stimulation using powerful hearing aids to entice more normal development in as many auditory connections as possible. Cochlear implants, which involve surgery to implant artificial sensing devices, are only possible for babies older than 2 years old with more than 110 decibel hearing loss. At 110 decibel loss, someone can barely hear sounds that to a person with normal hearing are very loud. Vision is the body's top intelligence gatherer. 25% of the cerebral cortex is devoted to it. At birth, the structures in the eye and brain responsible for vision are not mature. The retina is not densely packed yet, so this membrane lining the inside of the eye is not as able to transform light into brain messages. Neither is the optic nerve ready to relay brain messages, nor the brain visual center ready to receive them. The lens muscles are weak also, and not as able to adjust focus to accommodate different distances. Visual acuity, the degree to which fineness of detail can be perceived, is extremely limited even in normal infants. Newborns see no sharper than what is considered legally blind. Newborns focus best at about 12 inches, the distance between a crooked elbow and the face of a parent. By the age of 5 months or so, babies have visual acuity that measures 20 by 100. This means they can see at 20 feet what adults with normal vision can see at 100 feet. This is a big improvement over the visual acuity at birth, which was 2400. 2020 comes at about age 2. Amblyopia is poor visual acuity, lack of fine detail, despite a well-focused image on the retina. If not corrected early, it can be permanent. This is why abnormalities in a baby's eyes need to be corrected early to allow for maximum sensory input. Acuity is determined by asking babies what they see, right? If you said yes, you were sleeping. Infant visual acuity is determined using preferential looking tests, where babies look longer at items that are different rather than all the same. Infant visual acuity is also determined using visual evoked potentials, which measure and compare the patterns of electrical activity when visual stimuli are the same and when they differ. Corneal implants and corrective glasses can solve some problems. A patch over the good eye to force a weaker eye to strengthen can compensate for the amblyopia that results from strabismus, or crossed eyes, misalignment of the eyes. When eyes are misaligned, then the nervous system disregards the sensory input from one of the eyes, since the incoming information does not correspond. The suppressed eye does not develop normal visual acuity. This patch treatment has to be closely monitored under the direction of an expert to prevent amblyopia from affecting the good eye while it is being suppressed with a patch. By the age of 2 weeks, babies appear to be able to see color, as measured by visual evoked potentials in their brains. Preferential looking tests have found that babies by the age of 2 months can tell the difference between colors. Now, experimenters were careful to use colors with the same intensity or brightness, so that the differences noted were in fact due to the color or wavelength of light and not to the brightness or intensity. On a color TV, you can tell the difference between things by color. On a black and white TV, you use intensity or brightness to tell the difference between things. All the stimulation a baby or child requires happens in his or her everyday world. Sights, sounds, smells, tastes, touch. These are all experienced without the need for expensive purchases. With supervision, a baby can touch a feather, shiny aluminum foil, or pots, soft cotton, scratchy surfaces. Get on the floor, get on the grass, explore with your toddler, with your baby. Converse with him, converse with her, interact. Expose him or her to new sights and sounds and smells and tastes. Allow him or her to touch and explore new things in a safe context. Be enthusiastic. Be a partner. Never should love for a child depend on performance or learning or cooperation or obedience or anything. Every child should experience unconditional love. Every child should be loved simply for existing, not because of behavior or performance or learning.